And the CDC is cutting off all communications with the World Health Organization, effective immediately. The move is to comply with the executive order President Trump signed last week, withdrawing the U.S. from the WHO. And while federal law requires 1 year's notice before the U.S. can remove itself, Trump says the withdrawal should happen right away. This has experts warning of serious consequences, especially concerns over a bird flu outbreak in this country, which is growing. And this is what the press secretary said about the move just last hour.
DOJ and OMB have actually found that there was $37 million that was about to go out the door to the World Health Organization, which is an organization, as you all know, that President Trump, with the swipe of his pen in that executive order, is no longer wants the United States to be a part of.
Joining me now, Dr. Irwin Redlener, public health analyst and founding director of the National Center for Disaster Preparedness at Columbia University. For folks who don't understand all these letters, talk about the relationship between the CDC and the WHO and what it accomplishes.
Right, Chris. So this is what it amounts to. We have a very powerful entity in the United States, the Centers for Disease Control, which helps us get ahead of the major pandemics and infectious disease outbreaks and other illnesses that we need to pay attention to. But we work hand in hand with the World Health Organization, the so-called WHO, and that relationship is a powerful and important one. We cannot do this alone. We cannot set up a global surveillance system to give us early warning if a pandemic's coming our way. We are dependent upon our partners in the world, and they're dependent on us. We need each other. You know, there are Republican policies and conservative policies, and then there's stupid policies. And I hate to say that, but withdrawing the United States from the World Health Organization puts Americans at significant risk for all kinds of problems that we don't even want to have to think about, including the bird flu that you just mentioned.
Well, let's talk about the real world.
Yeah,
right now, the U.S. is handling a bird flu outbreak. What would this mean?
Well, this would mean that we would lose the benefit of the close collaboration with researchers around the world who are, first of all, looking for early signs of even greater spread of the bird flu, and also working on what we're going to do to prevent the bird flu or treat the bird flu. We can't cut ourselves off from that kind of information and expect to just be, isolated from what the world is doing around these important public health events. And America can pay a very steep price by withdrawing us for God knows what reason from the World Health Organization. It's one of the most outrageous, unacceptable policies they're putting forward right now. And it's, I don't know what to say, but I hope Congress is able to step up and say, no, Mr. President, you cannot do that. You cannot allow us to withdraw. First of all, it's illegal because we're supposed to give a year's notice. And second of all, we don't want to, even if we could step out of the WHO world right now, it would be dangerous and dumb for American public health and American safety going forward, Chris.
We only have a minute left, but I want to ask you about the administration's move to freeze some foreign aid, including instructing organizations in other countries to stop distributing HIV medications.
Well, I'll tell you right now, the biggest HIV program in the world is what President George Bush started, called PEPFAR, that has saved probably, 25 million lives right now. Dealing with AIDS and HIV in Africa, and they want to stop that. They've already shut off the computers of PEPFAR workers in Africa. I mean, it is ham-handed, it is dumb, it is dangerous, and it's profoundly cruel of what this administration is putting on the table right now.
Dr. Irwin Redlener, I know we had a compressed amount of time, a lot of news today, but we got in a lot of information. Thanks for coming in.
Sure, Chris.